You're either going to get pregnant really quickly with minimal intervention, or it's going to be an uphill battle, right? Because your MH is probably going to be pretty low at that point, and there's going to be a lot of other interventions that you're going to need. And so, really, if you are dealing with secondary infertility right now, or maybe you've had scar tissue, you know you had a traumatic birth, or even it wasn't a traumatic birth, but you had like an appendix removal, a fibroid removed, a couple years after, and your anatomy, your anatomy is different.
Yeah.
You know there's some scar tissue. Go see a pelvic floor therapist. They are trained to do something called visceral manipulation, which are manual techniques that can help to reduce the impact of scar tissue from surgery, or if you've had a prevalent condition like an autoimmune issue like lupus, or you've
Mhm.
had something called endometriosis, which we know is an incredibly pervasive disease process that impacts not just the gynecological system but the entire system. Those conditions can actually cause adhesions, and those adhesions are essentially a response, the body's response to persistent exposure to inflammation.
Mm.
And so pelvic floor therapists are incredibly trained to manage scar tissue. I never say don't go to do surgery to fix what surgery caused right away, unless it's obviously a life-threatening issue. But if you have gotten a ton of scarring and adhesions due to either surgical insult or persistent disease process, go get non-invasive support first, and then give your go at managing things hormonally.
So, can you tell me a little more about how pelvic health therapists
Yes.
play into you mentioned something about a manual.
Yes.
That
Yes.
sounds.
This is up my alley, and I'm so happy I get to talk about this.
Yes, because I've never heard
Yeah.
this being introduced into the infertility conversation. And it
Yes.
is another extremely helpful avenue where
Yeah.
you can go to find help.
I believe that one of the callings that God has given me is to make this space available. And I think that the alternatives that a lot of people have when it comes to infertility are very inaccessible financially. Sometimes they're actually too invasive for a lot of people. So, what is the options that are available, such as IVF or some of the medications and interventions? Some individuals just don't need it, right? Some people will really do well if their body is given the opportunity to be realigned, to be supported manually. And then, of course, for them to be taught about lifestyle, such as diet, exercise, and such. So, in the field of physical therapy or occupational therapy or rehab, so sometimes our PA folks, as well as nurse practitioners, can be in this field as well. Some of us are crazy enough to be pelvic rehab fertility specialists. And so, what we do is we use something called visceral manipulation or mobilization. And this technique is formatted to essentially mobilize the organs internally or externally in order to be able to increase blood flow to the organ and cavity
Mm.
and reduce adhesions or scar tissue. And this can create a lot of system reset and support to viable reproductive organs. So that's your uterus, your ovaries, and especially some people who have had endometriosis. I really always have a heart for the endo folks,
Oh my
is,
God.
because it's just like completely quality of life changing, right? But I always speak to like the fact that a lot of them have like persistent bowel issues. They have issues with, irritable bowel syndrome, something
Hmm.
called interstitial cystitis, which is also a pervasive bladder problem as well. So these techniques that we learn and we have can incredibly help you. So I say find a trained provider not near you. There are a lot of pelvic floor therapists that focus on prenatal, postpartum, but there are some of us who are the crazy folks who, who do all the preconception support, and even can see you post-operatively if you decide that, you're going to get the endometrial excision or you got to get a myomectomy to get rid of that fibroid, but we can really help to restore your system and set you up for a body that actually wants to stay pregnant.
And you've seen this help women with their fertility.
Absolutely.
Mm.
100%. It has been incredible. It is what gave me the audacity to teach it to other clinicians